Hello, everybody, and welcome to tonight's webinar. As you can see, this is being presented by BioStem Technologies, which is now the parent organization of Dr. Dave's Best. I think most of you know that. I've been telling you about that for a couple months now. And this, of course, is a realization of one of my dreams to improve the research and scientific basis behind everything that I do. And along with my usual interests of omega-3 fatty acids and telomerase activators, it's allowed me to become deeply immersed in the stem cell world and to see with my very own eyes and my very own body, because as most of you know as well, I tend to be a human guinea pig. Everything that I sell, create, or otherwise get involved in is vetted by myself, including all the treatments that are available to our patients through the stem cell facilities. I've had everything that we do, and we'll continue to do that. I think it's only fair and natural that somebody who goes out and starts telling you about things has done them. So, and I'll tell you, that's one of the things that makes us different, is that we're willing to do everything that we say. We're willing to take everything that we make, and we're willing to subject ourselves to some things that we're going to offer to the rest of the world first, just to make sure that the processes are completely appropriate and that there's no issues. Now, with stem cells, we've treated over the past decade in various formats with various facilities. Our cumulative aggregate experience is probably close to 1,000 people. So this is not new technology in any way, shape, or form, but we always do push the envelope. Patrick, next slide, please. There's a little bit of detail that I have to go in with you, or allow you to at least see this, because we are a publicly traded company. This is our disclaimer, and I need you to at least be aware of that, especially with the forward-looking statements issue. We're definitely not trying to influence anybody's behavior in terms of where they invest their money, etc. So please be aware of this. And then we'll just go right to the next slide. So I'm going to tell you a lot about stem cells tonight. Some of the questions that we've gotten over the past 3 or 4 months since we did the last webinar, some of the questions that we've even gotten from our clients, and believe it or not, lots and lots and lots of questions from physicians, especially anti-aging and regenerative physicians like myself. Some of them who actually offer this therapy. And that's scary, because a lot of them, frankly, I have to tell you, don't know what a stem cell really is. So we're not going to go into agonizing scientific detail, but there are going to be some doctors on the call tonight, and probably a few PhDs. So we want to make sure that everybody understands what we're talking about. The first word is adult stem cells. You may or may not know what's going on in the industry right now, but let me update you on that. On April 14th, at least that was the original scheduled date, was the final public hearing on the issues surrounding stem cells. It's very, very clear that the FDA has the intention of actually enforcing the law as it applies to stem cells. And as a matter of fact, there have been letters sent to some very well-connected, university-funded and based stem cell clinics, not just your average fly-by-night person out there, but a university-backed series of clinics have gotten cease and desist letters. So the way the law is written, and this was a congressional thing, you can't really blame the FDA on this one. They're simply the enforcement arm of Congress in this. And the way the law is written essentially is that stem cells are considered a drug. Especially from adipose tissue, which seems to be the method which most people in this country tend to use. And very, very simply and simplifyingly, fat is considered insulation and padding and nothing else. When you take it out of the body and you change it, or you extract cells from it, or you modify it in any way, shape, or form, the way the law is written is it constitutes a drug. And so anybody in this country who is using stem cells, especially adipose-derived stem cells, but also bone marrow or tooth-derived stem cells, is modifying the tissue, and in the modification of the tissue, they are violating the law because they are using an untested, unproven drug. This is in the eyes of Congress. The final hearing, the final public hearing, has actually been postponed because there was a lot of blowback on this, and the scientific community in this country, and of course the physician-based community, is trying to influence this. I don't know what your experience has been with public hearings on this, but my experience has been that they essentially are lip service, that the decisions are usually made and the agenda is usually set forth, and then the public hearings generally don't affect very much what decisions have already been made. But because it is a governmental agency in a democratic society with elected officials, it's necessary that they at least have those hearings. It does not look good for stem cell therapy in this country. Right now, there's what's called point-of-care therapy going on. I'm sure that there are still people doing that, mainly for joint pain and in attempt to modify the person's experience with their joint pain. And I'll explain what I mean by that in just a second. You notice I'm using the word curing or changing. I'm very, very careful. Because it's possible that someone is on this call from one of those organizations. So we don't use the word cure. As a matter of fact, let me say as part of the disclaimer that stem cells do not cure anything. They improve the quality of life. There's no question about that, and they can change certainly the symptomatology of many, many different problems, including things we call diseases, but they do not cure anything. It's very, very important that you understand that. And until the FDA recognizes some of the trials that are going on as curative, we will not use that word cure. As I said, it doesn't look good for stem cell therapy. The point-of-care therapies are still being rendered, but they are in violation because people are having to extract usually adipose tissue and modify it on-site at the time of the treatment and give it back to people right away. And that is considered manipulation, therefore it is illegal and unproven use of a drug. So that's kind of where we're at. As I said, it's going around. More and more people are getting letters to cease and desist. Now, how does that affect BioStem Technologies? Well, it doesn't affect us because we're in Guadalajara, and the government and the scientific community there is extremely supportive. But just so you know, your options for therapy in this country are extremely limited. It's possible you might be able to get into a study. However, more and more of the studies that we're seeing here, even though they are FDA approved and have an independent review board governance, a lot of those studies are becoming cost basis. So I can tell you there was a study on macular degeneration that is in process, and it's getting some remarkable results using stem cells to improve vision. I believe there's at least one published case report out there, or at least one press release talking about a case report. But that study costs approximately $20,000 to get into. So you're going to see more and more of these studies being more and more costly. Remember, university-based studies are going to be extremely conscribed. They're going to have a very specific set of conditions that you must meet before you can be allowed into them. So I understand, stem cell therapy is not an inexpensive therapy. Many people are trying to figure out how they can get it without paying for it. That's going to get more and more difficult, just so you know. Again, none of this affects us. We're in Guadalajara, Mexico, with a state-of-the-art facility, with state-of-the-art physicians whom I have trusted with my life on multiple occasions so far, and continue to do so without reservation. But it's bad for U.S. medicine, and it's bad for my colleagues in the field, and it's bad for anti-aging and regenerative medicine. By the way, when I mention the word anti-aging, that's a term that's going to be used less and less as well, because the FDA, FTC, DEA, et cetera, are starting to look at this term with a very jaundiced eye. It's permeated everything from milk commercials to cosmeceuticals. And as a result, I think its lifetime is going to be limited. You're going to be hearing more and more of the term anti-frailty associated with the frailty that comes with aging and some of the problems that are associated with that frailty, such as falls, inability to do things, and of course the ever-increasing cost of administering to our elderly population. So you would think that it's in our best interests to help people live more productive, stronger, healthier, less frail lives. But I don't see a whole lot of movement in medicine in that direction. Now, you've been staring at this slide. What are adult stem cells? Once again, I want to remind you, adult stem cells. Adults. We're not using babies. We're not using fetal tissue, although we have experimental protocols using umbilical cord. These are donated umbilical cord tissues. I won't get into that because that's not something that we do for most people. For most people, we use your own cells, and we're assuming that most of you are adults listening to this. A couple of words about adult stem cells. Adult stem cells are older than non-adult stem cells. So like any other cell in your body, your stem cells do age, and we're working very, very hard to look at how that happens and what we can do to mitigate that process. But it's safe to say that in most people, especially in most healthy people, the stem cells are biologically considerably younger than they would be in an elderly or a frail person. One very interesting side story, you may have heard this from me before. When I was in my infancy as a physician during my residency years and soon after, when someone would pass away, we would write in the terms old age on the death certificate. And some of you out there who are physicians are laughing if you're old enough to remember this, because it's been a long, long time since that kind of verbiage was allowed. Soon after, we were encouraged to write down, if we didn't know, cardiac arrest or heart attack, because that's the kind of thing that killed most people. And if you were fortunate enough to have a postmortem on your patient, many of them did indeed die of some form of heart disease. And so cardiac arrest became sort of the excuse du jour for dying. And then that was discouraged because it was skewing the numbers. It was making it look like more and more people were dying of heart disease, and that doesn't look good for the pharmaceutical industry or for my colleagues in cardiology or cardiac surgery. So we were encouraged to find other terminology to describe when someone got old and frail and died. In April, I believe, of 2013, an autopsy was done on a 114-year-old Dutch woman. I've written blogs about this. I've written emails about this. Many of you know this. This woman died essentially of a combination of factors, but the primary factor was stem cell exhaustion. In her bone marrow, they found 2 functional stem cells. Now, you should have hundreds of millions, if not billions, in your bone marrow. She had 2, and by the way, the telomere length, for those of you who know that the telomeres are the biologic measurement of aging that we use, the telomere length in those stem cells was 20 to 30 years shorter or older than the rest of her body. So we often hypothesize, the BioStem Technologies docs and researchers and I, that had we gotten a hold of this woman, we might have been able to expand her cells and give them to her and have her live a longer, healthier life. So I'm finally going to cover what I have in front of you, what are adult stem cells. So they're undifferentiated cells. That means they are generally not committed to more than a very, very broad series of cells. And you have different types of stem cells in your body. You're going to hear about endodermal, ectodermal, or hematopoietic cells. We are primarily going to talk about mesenchymal or mesenchymal, depending on how you pronounce it, stem cells today, and there's good reason. Again, I will cover that shortly. But they're undifferentiated. That means they have potency, the ability to become something other than what they are right now, and depending on what their origin and what their determination is, it is the overview of what they can become. And I'll show you a slide of what mesenchymal stem cells can become in just a few moments. They do reside in various and sundry places, including tissues and organs. So most organs have a variety of stem cells there, including the ones that will eventually be able to reproduce and become that organ. A couple of things kind of go hand in hand from the anti-aging standpoint, and that is that some tissues in the body are sort of born to reproduce. The gonadal cells, obviously, the germ cells, I should say, the eggs and sperm cells, liver, vascular endothelium, the epithelium of the skin, the lining of the gut. These are cells that have very, very high turnover, and what is uniform about those cells is that those tissues have high numbers of indwelling stem cells, and those tissues also have telomerase activity, because remember, telomerase, the enzyme that maintains, or in some cases lengthens your telomeres, is necessary to maintain a cell throughout cellular replication. So any tissue that replicates itself quickly or a lot allows these tissues to have a higher reproductive capacity than other cells. Now, as you know, things like heart and brain also have stem cells. They've been much more difficult to identify. There still is a little bit of question in the scientific community as to whether they are truly progenitor cells for the heart and brain, but all the evidence right now points in that direction. And I think we're going to find ways through signaling molecules of allowing these cells to become more active and regenerate. And as you'll see, this word signaling molecules, or this phrase, excuse me, signaling molecules, is really the primary thing that we're going to be talking about when it comes to stem cells. What is the primary function of stem cells? It's to maintain and repair tissue. So very briefly, aging, in my opinion, and again, this is not uniformly agreed upon by all physicians. As a matter of fact, most people don't agree with me, but it's my field of expertise and my passion, so I'm going to tell you what I think. I think there are two main drivers for aging. One is the loss of repair ability, which is directly related to the ability of stem cells to perform their job, and directly related to the length of the telomeres, and also just cellular replication in general. So damage, oxidation, inflammation, these kinds of things that we face every single day forces our tissues to repair and to reproduce at accelerated levels, and that's one of the drivers for aging. But you may have heard the term, the human body renews itself every 7 years, and that's also cellular replication. Our cells are designed in many cases to wear out and be replaced. It's a constant ongoing battle. I could make some numbers up for you, but I would tell you that no one knows for sure, but probably in any given day there are millions, if not hundreds of millions of cells that are dying and being replaced. The ability to do this with accuracy, the ability to do this with healthy cells, the ability to call in the troops, e.g. the stem cells when necessary, is what determines how well we age. And then finally, the ability to self-renew. That means these cells can give rise to other stem cells, not just other tissue cells, because tissue cells in most tissues that reproduce, the ones that I talked about are things like liver, vascular endothelium, the epithelium, that's the skin, and the gut, the lining of the gut. These cells can reproduce and give rise to daughter cells, but they are not able to maintain their stemness. Stem cells have the ability to give rise to cells that are eventually going to differentiate into something else, but also to give rise to more of their own kind. And one of the things that happens with aging, and again, this is debated, but this is what we feel based on all of our clinical experience as well as our research, is that we do, in many cases, drop the numbers of stem cells as we get older. Once again, the Dutch lady certainly proved that. And we also lose the ability for those cells to respond to those signaling molecules. So once again, you hear that term, signaling molecules. Keep that in mind as we move along. Let's go to the next slide, please. Okay, this is, you don't have to focus on this too much just to understand that the types of stem cells that we use, the mesenchymal stem cells, we harvest them from bone marrow that can be gotten from fat. And there's, of course, a little story there for you, which I'll get to when I'm done describing the slide. But remember, most tissues have many different kinds of stem cells. The mesenchymal stem cells are present in every tissue that we've ever biopsied, every tissue that's ever been studied, even if it's not from the mesenchymal origin. There are mesenchymal stem cells in there. Why would that be? Well, because all tissues need some form of blood to survive, and mesenchymal stem cells give rise to blood vessels. They have a specific property known as angiogenesis, which means they stimulate the growth of new blood vessels, which it doesn't take a whole lot of imagination to see how that might help somebody with a vascular issue or with a heart issue, because most of the problems that we see in the aging population and to some degree in the younger population have a vascular component. The MSCs can also develop into muscle. They can develop into fat, they can develop into cartilage and bone, which makes them very, very useful for the non-surgical approach to improving joint health for people who have joint issues, and we obviously have a lot of athletes as clients, and some of the nervous system cells as well. Now, one of the things I want to tell you, remember I told you I was guinea pig, and along with one or two other of my brave compatriots who are members of BioStem Technologies, we've subjected ourselves to different modalities to harvest stem cells. So we've all had our bone marrow taken. I don't think any of us have given teeth for this yet, and I'm not going to volunteer for that. But we've all also had liposuction. Now, I'm not an obese individual, and the person doing the liposuction, who I'm just going to name by name, Dr. Ben Schlechter, a dear friend of mine, wonderful plastic surgeon, had a heck of a time getting enough fat out of me to do this. But we've all been through this, and the bottom line is this. In terms of getting stem cells, I will take bone marrow aspiration anytime. The way we do it, we basically put you into under twilight sedation. It takes about 15 minutes or less. We aspirate the bone marrow from the back of your hips, and there's minimal pain involved, and within a 24-hour period of time, you can go back to more or less your daily activities. It took me a month to get over the liposuction. Now, some of that may have been because I'm not an obese individual and it was hard for them to find fat, but it was uncomfortable, and I've shared this with my colleagues, the two other folks in our in BioStem Technologies who had this done, and they both said the same thing. This was not a pleasant procedure. So fat aspiration is painful, and I'll also tell you that in our opinion, it's much, much easier to get higher quality and better numbers of cells from bone marrow. So we stick with bone marrow. But we didn't do this just because that's what we do. We did try the other methodologies on our own so that we would be able to speak from experience. As I said, I would not want to have liposuction done again. I most likely will have bone marrow aspiration done again because we're going to be comparing telomere lengths and other behavioral characteristics of our stem cells over the past 2 or 3 years that we've all been treated. So as part of our research, you know, we're going to be the guinea pigs. We are the guinea pigs. Okay, next slide, please. Okay, so you can get stem cells from different places. The teeth are not mentioned here. Again, it's difficult to get a large number of cells from the tooth. A rule of thumb, which you don't need to know, but just sort of keep in mind the numbers, is that for every kilogram of weight, you need about 1 million stem cells to get the kind of effects in the signaling molecules that we're looking for. Now that's animal data, but we go based on that as far as people too. So, you know, we're always looking for a couple 100 million cells when we give them to our clients and patients. And in order to do this, we have to expand those cells. That is particularly illegal in the United States of America. So you have to come to Mexico or some of the other countries to have that done. You can get what's called a stromal vascular fraction or the Buffy coat, and you can get that right away. The bottom picture on the left is someone who's having a bone marrow aspiration, but it's different. It contains stem cells, and it contains other anti-inflammatory cells. I kind of liken this to those of you who've had platelet-rich plasma. I liken it to that with stem cells. But the pure stem cells have to be isolated and grown, and that's one of the procedures that we do as part of our standard package. So our standard package includes both the aspiration, the return of the buffy coat immediately upon aspiration, or a couple hours later after your recovery, because we give you an hour or two to wake up, and it takes a little bit of time to process those cells. And then we bring you back at some interval determined by you and us and give you the pure stem cells. And that's one of the things that separates us out. So not to dwell on this, let's go on to the next slide, please. I'm trying to save some time for questions, by the way. We've already had a couple questions, so I will get to those. Mesenchymal stem cells, the real reason I think that we use mesenchymal stem cells is because they seem to cover a lot of what goes wrong with us as we age. They cover joints, cartilage, and bone. They cover vascular endothelium. They cover the loss of blood supply. They moderate and mitigate the immune response, and they tone down this ever-present, ever-growing inflammation that seems to be part of the aging process. And we wrote a paper about this, so I'm going to defer that a little bit. But from my standpoint, it's super convenient and super cool that this particular line of stem cells addresses what tends to go wrong with us as we age. The other things that are useful is that they have a very low immunogenicity, meaning that they don't tend to cause any kind of immune reactions. Now, we don't give you somebody else's cells, we give you your own cells. But point of fact, we probably could give you somebody else's cells because the immune determinants are missing to a large degree from mesenchymal stem cells. So it just makes them easier you don't have to worry about those kinds of things. And again, they're your cells. We just grow them up in a proportion or a number that is much larger than you have circulating. And when we get to the anti-frailty, anti-aging thing, I hope to cover that with you as well, because it really underlines what stem cells do and do not do. So let's move on to the next slide, please, Pat. Okay, this is really critical. Stemness, which is all those things I talked to you about before, the ability to self-renew, the ability to become other things. These are not really what explains the repair of tissues and even the growth of new tissue in your body by these expanded and transplanted from you, if I may say it that way, mesenchymal stem cells. So let's go back in our histories a little bit. Let's go back to when we're born. You have two things that are really, really cool when you're born, among probably many more, but two things from the anti-aging and regenerative standpoint. Number one, you have long telomeres, which means your cells are super healthy and they're capable of replicating and growing, and you don't suffer because of that, at least not until you hit, maybe 30 or 35. You also have a lot of stem cells that are circulating in the body, roaming around ready to repair things, probably hundreds of millions. As you age, that number goes down, and along with that going down of the number goes down your repair ability. I always separate those words. It's easy to say them as repairability, but what I say is repair ability, your body's ability to repair itself. And I want you to really focus on that and distinguish that from any other meanings you might associate with repairability. Repairability, the ability of the body to fix itself. Again, in my opinion, one of the primary determinants of aging. The less well that you fix yourself, the less well that you age. And so what does explain why MSCs and multipotent stem cells of many varieties, what does explain why they work? Well, one thing is you reproduce the numbers that are similar to what you had in your youth. That makes them a force to be reckoned with. Your body, for at least a brief period of time, probably 6 to 9 months, sees this different milieu inside of it. It's like, oh my gosh, I'm young again. Now I'm being hyperbolic and I'm overstating it, but you understand this is not something that the average 40, 50, 60, 70, 80-year-old person has. And that's something that you can get. And believe me, in terms of reprogramming the inflammation in your body and your immune system, this is a very, very valuable thing. So how does that work, or what happens? Those cells that we transplant in large numbers back into your body essentially secrete. They're factories. They make these chemical signals that tell your body, fix yourself, fix yourself, fix yourself. And in addition, they have a wonderful property called homing. And then as they respond to signals that are being sent out by damaged tissues, so you add this repair ability to the ability for the cells to home or seek areas where they are most needed. And you can see why we get some phenomenal results with stem cells and why people have less pain and better quality of life. And this is something that's becoming more and more accepted by the scientific community. What most people, including doctors and the general public, think as they think of, oh, we're going to grow new tissues. That's going to be a lot harder than we think, although it will probably happen soon enough. As some of you know, that in Sweden at the Karolinska Institute, a series of tracheal transplants was performed. If you follow that literature, that is not without problems. I mean, I applaud the people that did it. I think they're very brave, and it's wonderful, but it's not going as well as they had hoped. So I think we're a long way from growing hearts and brains and livers. And as you may have also seen, those of you who follow the literature, there's a sort of sidearm now that we're going to try to use animal tissues and genetically reprogram to look more like human tissues. So this concept of growing new tissues it is misplaced in the sense by these sort of cutting edge but fantastic and not ready for prime time therapies. The trachea in particular, because it's a structure that can be reproduced in plastic, is a unique thing. That's not the case with most organ systems. So I won't dwell on that, but I want you to understand what really, really happens here is this volume, this new volume of stem cells that comes in is making these chemical messengers and homing in on areas that need help and re-educating the indwelling stem cells and some degree the somatic, that's the non-stem cells, just the ones that make up the tissue normally, to behave younger. We don't have data yet on telomere length, but our suspicion is that it also lengthens your telomeres, which of course makes the somatic and the stem cells function better that are indwelling. Now a question that always comes up, well, is if you take those stem cells away from me, you're going to be missing them. Well, the answer is no, because the stem cells have the capacity to self-renew, and one of the stimulus is a drop in number. So unless you're really, really sick or really, really old, the answer to that is no. And if you're concerned about being really, really sick and really, really old one day, then by all means come, get your therapy, and let us bank your stem cells so that you'll have them when that actually happens, because we do bank them, and at this point they're good for about 20 years. We're working on some protocols that will extend that, it's a very, very exciting area that I'm involved in. But understand, we're not growing new tissue because we gave you all these cells. We're improving the tissue makeup and the behavior of the tissue, and we are growing things like new cartilage and joints because of these chemical messengers that we turn loose in a higher number, higher values than you would have normally. Okay, next slide, please. Okay, I'm going to just blow through this. For those of you who are docs, these are the criteria. There are specific criteria, and the reason this is important, and again, we like to differentiate ourselves at BioStem Technologies from everybody else out there. We know what we're doing. Okay, this is just one of a series of tests that are done at every step of the way when we harvest your stem cells and when we grow them. We have gone to different facilities and been asked to evaluate their protocols and procedures, and things like the ability to maintain laboratory environment, things like the ability to establish clear-cut reproducible protocols. These are the things that are reasons cited by the FDA for shutting down stem cell clinics. So we don't have that issue because we're adherent to all the rules and regulations. We control our laboratory environment. We do these and other tests every single step of the way to ensure you that you're actually getting stem cells. I can't tell you the number of times we've been shown samples in the U.S. by people doing this that don't contain stem cells. So you hear people say, well, they gave me 1 billion stem cells. And no, they didn't. We don't know how many stem cells they gave you. And my guess is that in most cases, the physicians are smart enough to not use the word stem cells, and they simply use the word cell. We gave you 1 billion cells, and that's implied, or the patient client believes that they're stem cells. In many cases, that is not what happens. In many cases, we see all kinds of cells, from fat cells and crenated dead red blood cells and all kinds of other cells that are not stem cells and don't have any anti-inflammatory properties and do not have any ability to influence the chemical messenger situation in the body. So our experience, our clinical experience in this, is one of the things that makes us different. Our adherence to these extremely strict protocols, and as you'll see later, we publish in the field, which I think as an industrial, scientific, or a biotech company really sets us apart. We're not just, a doctor's office that went to a weekend seminar on how to do this. We've been doing this for a long time. Okay, next slide, please. Okay, generally speaking, we shy away from diseases, but I'm going to tell you these are some of the things that we've seen good results with. I'm not going to go into more detail of what good results means because it's too easy to use the word cure. I'll simply say we've improved the life of people with these diseases, and most of these are at least beginning to become documented in the scientific literature. Peripheral artery disease. Remember I told you about this thing called angiogenesis, this ability to develop new blood vessels. Well, peripheral artery disease such as limb salvage or diabetic limb salvage, people who have what's called claudication, they have clogged blood vessels in their legs and they can't walk. We've had phenomenal results for those. Pulmonary, we've had people come off of oxygen, we've had some people come off of ventilators, we've had a lot of improvements in COPD, or chronic obstructive pulmonary disease, based on this. Again, it doesn't cure anything. We're not we treat, but we've had improvements in the quality of life of these people. And certainly somebody who's tethered to an oxygen cord or a ventilator appreciates the fact that they don't have to have that anymore. Cardiovascular, so both from the standpoint of inoperable artery blockages to congestive heart failure. Again, just a little clinical vignette. Someone who comes in class 3 or class 4 heart failure, and for those of you who are doctors out there, we'll use the New York classification. New York class 3 or 4 has a lot of trouble ambulating, getting around. You can see remarkable improvements in that with one treatment. Sometimes arthritis, we kill it with arthritis, folks. We do a great job of regenerating tissue, new cartilage, those kinds of things. And it represents a great alternative for someone who doesn't necessarily want to go have a joint replacement. Although, obviously, if you come to us earlier, the better we're going to get. We have a lot of sports figures that come to us to avoid surgery and to help them with the discomfort and function of their joints. And that's the next one, sports. Diabetes, we don't treat the sugar issues with diabetes, but we treat the inflammatory issues and mostly the vascular issues. And of course, the neuropathic pain is another thing. Lots of people suffer from neuropathic pain of diabetes. And we've seen great improvements in the quality of life with that. The anti-frailty, and in a minute I'm hopefully going to be able to direct you to our study. As a matter of fact, Patrick, why don't you work on that while I talk about anti-frailty. So anti-frailty specifically means what happens to us as we get older. And I'm going to introduce two terms to you, which those of you who have read my blogs may have seen these before. One is sarcopenia, and the other is dynapenia. So sarcopenia is the loss of muscle mass that happens with aging. And this is a loss of the ability of the body to keep up with damage and the inability of the satellite cells, which we now identify as muscle stem cells, to contribute to new muscle to replace the old tissue that's either been turned over or damaged. So that's sarcopenia. The other is dynapenia or dynapenia, and that's the loss of power, the loss of strength. You would think, as I would, that the two don't need to be explained. Obviously, if you lose muscle mass, you're going to get weaker, but this is science, folks, so they got to have a term for everything. So we have sarcopenia and dynapenia, both of which are recognized complications of aging. You have before you a paper that was published by Dr. Gonzalez, Dr. Geffner, and myself, which to my knowledge was the first paper published on explaining why mesenchymal stem cells may interfere or improve the aging process. Now, you know I'm a telomere guy, and I use telomere length to talk about chronologic age and biologic age. Your chronologic age is how many birthdays you've had. Your biologic age is how young your body actually behaves or how old. And the two are not necessarily related at all. And one of the driving factors for aging is inflammation. And there's very few doctors who would argue with that. Now, some may argue with the degree, and some may argue with the way we've presented it here. But it's a driving factor for aging, like it or not. And as time goes on, more and more of that is going to become apparent. So as we lose the repair ability in our body, we also lose the ability to combat inflammation. And if you look at the genomes of people, and again, I'm going to look at this 114-year-old Dutch lady that I talked to you about at the beginning, who had only 2 functioning stem cells and very short telomeres in her stem cell compartment. Those people are generally a lot more inflamed at 100 than they are at 40. And this is a self-propagating thing. Now, why does that happen? Well, in this lady's genome, there were thousands of mutations, okay? She didn't die of cancer. People are always telling you, the somatic mutation theory of cancer, you get cancer because genes mutate and you get cancer. That's a whole other different lecture, and I'll just simply tell you that I don't buy that 100%. This woman had thousands of mutations in her genome. They were called, I guess, carrier mutations. They didn't really affect anything. So she didn't die of the usual causes, heart disease, cancer, and infection. But clearly, she was not able to control inflammation in her body. And the inflammation is this pro-inflammatory situation that happens as we age, drives the aging process. And it does so through something called epigenetics, not through the genome necessarily, but through the epigenome. Those of you who have seen me speak at David Wolf have probably seen the little diagram that I use to explain epigenetics, and there's many different ways to talk about it. But the way I show it is, I showed like a Rubik's Cube, a little square with 50 or 60 different colors in it, and that is the genes which are being expressed in a young person. And then I show in a 90-year-old the genes which are being expressed. And it's a totally different colored Rubik's Cube. The genes are the same, but the epigenetics has changed, and which genes go up and down has changed dramatically. So this is what's driving inflammation, along with the slings and arrows of everyday life, such as sedentary behavior, not enough exercise, too much exercise, lousy diet, not enough sleep, probably effects of stress, and many, many other things that toxins in the environment, electromagnetic radiation that's a part of everything that surrounds us. So all these things are things that are pushing the inflammatory condition in our body. But it's a self-fulfilling prophecy, because even as we just had replacement, we would still have telomere shortening and cellular replacement, which would eventually outpace the ability of the stem cells to keep up. So if you're going to combat aging truthfully, you're going to need to improve the numbers and function of your stem cells, or at least keep them where they're at when you're young and healthy, and you're going to need to extend your telomeres so that your somatic cells do the same, and your stem cells. So this is our article. It's about a year old now, I guess, and we have other articles in the can that will be published. It takes about 2 years to get your data to be published in one of these peer-reviewed journals, but you'll see more from us sooner rather than later. Okay, next slide, please. And while we're working on that next slide, the inflammatory milieu is also driven by these chemical signals, and that's why when we give you your stem cells and they start making a more youthful signal kind of thing, you will see benefits in these anti-inflammatory markers. So if we were to take you in and repeat that study that I just showed you, the paper that Dr. Geffner, Dr. Gonzalez, and I wrote, we would be able to document those very same changes in you, and we've done that in ourselves as well. Those inflammatory markers drop off the map. So a little bit about our clinic right now. Our main functioning clinic is in the beautiful city of Guadalajara. It's a city of 6 million people. It's in a very safe, very productive, very cosmopolitan area of Mexico. It is a world-class medical facility. It's a privately owned hospital. Doctors treat, the presidents and politicians and generals of Mexico there. It has the newest technology, and we have the best doctors there, just wonderful doctors. As I said, I put my life in their hands on numerous occasions, and I would certainly not have, I have no reservations about going there. And soon, down the road, we'll get some of our patients on the call for you so you can hear their experience. It's uniformly wonderful. Everybody loves Guadalajara. Everybody loves the doctors and nursing staff down there, and everybody is very, very happy with our treatment. Otherwise, we wouldn't be able to continue to do what we do. Next slide, please. And by the way, that ability to work in a private hospital setting with a complete cooperation of the medical and nursing staff is another thing that sets us apart. This is not a doctor's office. This is a full-fledged hospital where just about everything under the sun can be done. They have gamma knives there. They do cardiac surgery there. Everything that needs to be done. So we have a staff that is broad and deep there, and you will not get that at most places in the U.S. What happens? Okay, your job is to get there, and I'm going to show you some information, because every time we do one of these, 3 to 6 people sign up to get treatment or come back again. And so I'll give you the contact person for that in just a little bit. But just to tell you a little bit about what happens, you get yourself to Guadalajara and we take over from there. We have a dedicated transport service. We have concierge people to take care of you and to make sure that your experience runs smoothly, to make sure you know where to go, to direct you, and basically hold your hand while all this goes on. And it's admittedly a little scary for people at the first time, but once they've been there once, it never again is an issue. So a fear of the unknown, if you will, but believe me, we make it easy, we make it smooth, and we make it a beautiful experience for you. Again, we've never had anybody say they're anything less than excited about what happened and coming back. And we are a state-of-the-art hospital. Okay, next slide, please. And by the way, if you're a tequila drinker, which I'm not a drinker anyway, you will love to tour the town of Tequila. And even if you're not, there's a phenomenal distillery there you should see called Herradura. It's one of the oldest in the world for tequila, and it's magical. And then, by the way, there's a lot of other sites. There's some beautiful archaeologic sites, and you're about 4 hours from the beach if you want to go to the beach. So if you come down and see us, plan on a couple extra days and at least see the city of Guadalajara. You will be blown away. It's called the Pearl of the West in Mexico, and not without good reason. So some more specifics. How do we do this? Once you arrive and we get you settled in your hotel, you'll be given your schedule, usually the next day. Any blood work that needs to be drawn is usually done either in the morning of treatment, and your treatment then is in the afternoon, or we have it done in the U.S., or we have it done the day that you get here and do the extraction the next day. The extraction you put under twilight sedation, best sleep you'll ever have, and it takes about 7 to 15 minutes to obtain the bone marrow from your hip. We usually use left and right side, so there's 2 small puncture marks there about the size of mosquito bites. And then while you are waking up and waiting in recovery, our team of scientists goes to work on isolating your cells and getting you back what's called the buffy coat. And we give those back to you usually within 1 to 2 hours of your extraction. And then we send you on your merry way within the next 1 to 2 days, depending on how much time you want to spend in Guadalajara. And there's usually some communal stuff that goes on. meaning we often have little dinner parties for everybody, and they are enormously fun because you get to meet some star clientele when you're down there, some people you wouldn't otherwise meet, and you get to meet some like-minded anti-aging and regenerative medicine pioneers, and you get to hang out with us. We're really a very interesting and fun group of people. And then we just arrange for you to come back at 6 to 8 weeks, and this is our standard package. It's a one price package. I'm not going to discuss price here online, but we have that one standard package that includes both therapies, and that is again unique. And we believe in order for you to get the best treatment, you shouldn't just have the Buffy coat, although we can offer that to you if that's what you want. But we think you should have the purified stem cells a few weeks later as well. Next slide, please. And then we'll get to some questions. Again, this just reminds me to tell you that there's a lot available for you. The only thing you really have to do is get to Guadalajara, and we take care of the rest. Lots to see. Next slide, please. Okay, for more information and to have a detailed discussion, to find out any questions that I don't get to cover tonight, pricing, travel arrangements, etc., these are the numbers you can call. Tony Della Mazza is our president of cell therapy. This is what he does. He makes all this magic happen. He basically oversees the procedure from the moment that you call him until you're actually in the hospital having your stem cells. We also have the 1-800 number for BioStem Technologies, and we're happy to answer your questions. So I'm going to get to questions now, since there are at least one or two, and please feel free to ask your questions. The first question was, are the rules different in Canada? Not to my knowledge. They pretty much follow our lead. I don't think there is a significant amount of difference in Canada, and while they have a fully independent medical system and very capable physicians and scientists up there, they do tend to more or less follow the lead of the U.S. in this type of thing. They may not be coming down quite as hard as the U.S. is on this point of care therapy, but I can also tell you that while the exchange rate is favorable in Canada, it's not as favorable as it is in Mexico, so you're going to spend more money going up there. If you can actually find these types of treatments. I'm simply not that familiar. We have a lot of business contacts up there, and we have a lot of people from Canada who are interested and have invested in what we do. So, you know, if they had it up there, I think we would hear more about it. Let's move on to other questions. And if there are no other questions, then I'll just open the floor to anything that you want to ask me. Because I certainly enjoyed communicating with everybody. So we do have some questions here. Go ahead. Patrick, why don't you take over and read these questions, and I'll answer them one by one.
Sure. Janice wrote in that she wants to know how successful that stem cells are for cirrhosis of the liver. Something you could talk about, Dave?
I can talk about it. So first of all, remember, stem cells don't cure anything, and the major cause of cirrhosis now is not alcoholism anymore. Believe it or not, it's fatty liver. Fatty liver causes more hepatic failure, and non-alcoholic cirrhosis is the #1 cause of cirrhosis. So it's our damn diets. And by the way, someone out there is going to write me a nasty letter when I say this, but in my experience researching the opinion, it's not because people eat too much fat, it's because they eat too much carbohydrates. And those of you who are interested in finding out more about that can go to my ketogenic blogs, Dr. Dave Unleashed. I don't want to get too deeply into that. Now, what is the capacity of stem cells to improve cirrhosis of the liver? Again, mesenchymal stem cells may or may not differentiate into hepatocytes. They clearly can differentiate into pancreatic cells, and there's work that shows that you can actually interchange, at least in a petri dish, pancreatic cells and hepatic cells. So it is not without possibility that they may actually regenerate some of the liver cells, but we don't have codified experience. That's not to say that we haven't treated anybody like that, but we haven't published on that. I'm simply going to say that the likelihood is that we can improve some aspects of that. We can improve the overall health of that person, because usually when you have cirrhosis, there's a lot of other things that are wrong with you. But to restore your liver to fully functioning phase, that's going to take some very specific biochemical messenger changes and things that are not quite yet worked out. But one of the things I like to tell people is when they have conditions that do respond, even in part, or they have improved overall health or improved overall lack of pain and quality of life, is you're buying runway. You're buying something in a sense that's going to allow you to be in better shape when the next thing comes along. Gene therapies and these kinds of things, which are just around the corner. There's always going to be a point, I think, in our lifetimes where we can't salvage people. We can't get them back. 200, 300 years from now, you've seen all the sci-fi movies where they take a fingernail and they grow it into a new human. That may be possible if that's ever gets past the ethical stages. Right now, we're not there. So I think we can improve the quality of life of people, but I don't want to give you a quantitative answers like we're going to grow back 70% of your liver. Remember, the liver is a highly regenerative organ in its own, and once it's damaged to the point where it can't regenerate itself, you're at the far end of the spectrum. So I would be cautiously optimistic about our ability to help somebody, but I would certainly never promise a cure. Stop eating carbohydrates, by the way. Next question.
All right, before I dive into all of these, Dave, there are a number of questions about very specific diseases, disorders, etc. I think the best advice for many of these people would be to speak with someone directly like Tony and address their personal questions about it, or do you want to go over all of them?
I think I'll give you an overview, and then I'll just mention some of the diseases we've had more clinical experience with, and those are the ones that we've listed. But if there's an inflammatory component to this illness, which is a lot, okay, there's chances are that you will have an improved quality of life and feel better from stem cells. Where stem cells have pretty much no application is in the single gene or polygene defect. So we get a lot of people saying, my son has this, rare genetic disorder. Will stem cells help him? Probably not. Okay, if you have a rare genetic disorder, you just have to bide your time and hold your breath and hope that gene therapy is coming for that particular condition, as it will for most conditions. Be aware that many of the conditions that affect people as they age are polygenetic, or polygenic, I guess is the right word, meaning there's not one specific gene that causes the problem. There's loads of them, and frankly, it's usually an epigenetic thing. This is why I have problems with these mouse models and cell models where they knock in or knock out one gene and they say, look, we've got a potential cure or a potential drug for this disease. There's very few illnesses that the average person suffers that are single gene. I will say this much, that one of the things we're working on is utilizing stem cells as payload delivery vehicles. I can't get into that any deeper because it's proprietary information, but right now one of the ways that gene therapy occurs is through viral vectors. You have to essentially give yourself a viral infection. We hope to change that with the stem cells. So if your illness has a inflammatory component to it, chances are we can improve your quality of life. One of the things that was left of that list is autoimmune diseases. We really have a great track record with autoimmune diseases, things like rheumatoid arthritis and lupus and those kinds of things. Usually respond pretty well to these, and we have a fairly extensive experience with those conditions. So Pat, why don't you just do me a favor and read off the actual these conditions, and I'll just weigh in on those rather than go to the specific details of the question. Just pick out the disease and I'll say yay or nay.
Sure. Actually, lupus was just asked by Gary, and I think you just covered that.
Yeah.
We've also
one qualifying thing on lupus is if you're in the active throes of lupus and you're on immunosuppressants, that is not the time to get stem cells, because immunosuppressants will modify the stem cell effect and basically squash it. So if you're in high-dose prednisone or methotrexate or one of the other immune-modifying agents, that is not the time to get stem cells. Wait till your disease is in remission. That said, a lot of people have chronic ongoing low-grade problems with these autoimmune diseases, and that is a good, we can treat you on those, but you can't be on high-dose immunosuppressants, which is going to mess up the therapy. I should be very, very clear about that. Continue, Pat. Sorry for the interruption.
Sure. Alzheimer's was mentioned.
That's a toughie. I'm not going to say that we can't improve conditions, but right now everything we have is anecdotal, meaning it's not in study protocol. I would say that in general, the general health of the Alzheimer's patient improves enough as long as they're not so far gone that they're barely immobile. Remember, you have to get these people to Guadalajara, Mexico to do what we do. Keep that in mind. But things like early Parkinson's, early Alzheimer's, given the fact that very little else works, I would say that we could be cautiously optimistic that we might be able to improve those qualities of life for those people.
HCV?
Yeah. Again, the viral illnesses, you have to be off of immunosuppressants, but because of the immune programming and reprogramming that the stem cells do, it is, again, likely. Now, we go down a list of 1,000 diseases, and I can tell you that we can probably help you. The diseases I showed you on the slides are the ones that we have enough longitudinal experience with people to really come out and say, this is where I think we're most effective. But you said it best yourself, Patrick. The individual cases are best handled by going through Tony. So if after this presentation you have heard enough to make you interested in these therapies for your particular problem or your loved one's problem, Tony will go into much more detail, and you'll be consulting directly with physician and scientific staff. Overall, again, viral illnesses, it's certainly worth looking into because of the immune modulation that stem cells have.
How about fibromyalgia?
Yeah, good question. There's definitely an inflammatory component to fibromyalgia, although most people feel that it's a issue with neural transmission from the periphery up the spinal cord to the brain, making a sort of hypersensitivity reaction. But we've had people who definitely feel better. The other thing I will tell you that what we try to do in most cases is before we get people down, we try to precondition them in situations where supplements might be helpful. We use them. So somebody who had fibromyalgia, we would probably go for high dose omega-3s and some CoQ10 and some carnitine and some other things to really try to get that person feeling better even before they have the stem cell therapy, so that we can really nail it for them when they come down and see us. So I should mention that we're big users of preconditioning supplement routines for people as well, and that is usually part of the package. So yes, I think that's certainly worth your time and energy if you have that condition.
How about people with without identified illnesses, but rather people who have low energy or stamina, or who are otherwise healthy individuals who are, lots of questions, but in their 40s and their 50s and whatever age they are, what kind of effect would a treatment have on those people? Well,
again, it's variable. Everybody's different, but I think you're actually talking now about the bulk of the people that we see. It's very, very exciting as a scientist and a physician to see somebody improve significantly in their quality of life and their symptomatology from an illness or from a bad knee or bad shoulder or from a viral illness or from cardiac conditions. Really, really exciting. But the bulk of what we do is this sort of anti-aging regenerative, now known as anti-frailty. And in terms of stamina, energy, etc., I can speak for myself. You know, I've had multiple treatments now. After each and every one of them, I genuinely feel younger and feel like I have more recoverability and ability to recover from workouts. I used to be an ultra marathoner. I'm actually picking that up again after almost a decade of not doing very much running because I couldn't. Because I had, you know, joint pains and aches and things that no one could seem to pin down, and I couldn't sustain the training needed, and that's all gotten better. So I can tell you in my own personal, from the standpoint of energetics and verve and the ability to live life to the fullest. I mean, this is the reason why I got involved in this, and why if you're interested in you know, staying younger or feeling younger. This is at the top of the pyramid. You know, it's right up there with telomere therapy, and it's more immediate. You know, within a couple of weeks, most people are remarkably impressed by how they feel. Now, the next question would be, well, how long does it last? Again, that's variable. Some people come from one treatment, we don't see them again because they don't need it, or you know, it's been a couple of years and we haven't seen them. They may be back in 2 or 3 more years, but then other people become literally junkies and want to come down and you know, have therapy, you know, every 3 to 6 months. So the individual responses are individual, and how much or little you get out of it is also individual. But we're all very, very optimistic, and most of us on the staff are in the 40s, 50s, and 60s, and so we're a very good test audience to tell you that this is an important part of feeling better as you get older.
There's been concern from people who have questions, who have issues that you've addressed, where you said there wasn't a whole lot of experience or data available. Is there a benefit to those people banking their stem cells now and waiting for research to progress a little bit?
Depends what the problem is. Remember, your stem cells age as you do, although they don't age in parallel. Most times they are quote-unquote biologically younger. We have people in their 60s and 70s who we've had to use different types of therapy for, and we've had to go to, you know, cord cells because their own stem cells just don't pass muster. They wouldn't be worth giving back. And those people are clearly, you know, on the road to perdition from the anti-aging or the aging standpoint. So is it worth banking them if you're healthy and you just want to make sure that, let's say you're 35 and you want to make sure when you're 45 or 55 that you can have those 35-year-old cells, so to speak. It's a great idea to bank them, and we always encourage people to bank when they get therapy, or if they're quote-unquote too young for therapy. The youngest person we treated, by the way, is 29, and that I am cautious about using these words. I'm simply going to repeat their logic. These are their own words, not my words. They said, I'm doing this for preventative reasons. So a 29-year-old person getting treated and banking their cells. So yeah, there's a lot to be said for banking cells, and we do hope to be able to de-age people's stem cells. We do hope to be able to add decades to the storability, if you will, of the stem cells. Right now it's about 2 decades, but stuff happens. We've all seen it, especially those of us who are in the medical field. You cannot possibly predict what can happen to you, and how wonderful would it be to have your very own stem cells ready to go should you suffer a major illness, you know, car accident, cardiac surgery, some other thing that might happen, and then have those cells there to jumpstart the system at some point down the road when you need them. So banking is a super good idea.
I think I've covered most of the specific questions. I just once again want to reiterate that if you've got more specific questions, make sure that you put the BioStem number or Tony's number into your phone. I'm sure both of them are slammed right now with people trying to talk about specific issues, but they could address it more clearly than we could. If I could just go back to the regular, non-specific, I guess, questions. Just to tie back into what you said, Joanne wants to know, and I'm paraphrasing here, if it's possible to enrich one's own stem cells with stem cells taken from an umbilical cord or the umbilical cord blood of someone else.
Yes, it's possible. It is in the United States, that's not possible unless you're part of a protocol, for sure. So using those kinds of things, I don't like to talk about them, even though we do them. And of course, all of us have had that as part of our therapy, just again from the guinea pig standpoint. So it is possible. The merits of doing that versus the merits of using your own cells is worth an entire another lecture. And when we clear all the regulatory hurdles, even in Mexico, where that becomes doable, then we'll talk more about that. But I'll simply say at this point that it is possible.
Phyllis wrote in, she's wondering how quickly after the second stem cell visit are results typically seen, and I'm sure people are wondering even about the first visit, how quickly they can typically see results.
Yeah, I mean, I've seen, it varies, and everybody's different and individual. The cases that tend to stand out are the remarkable ones. So one of our more famous clients brought his mother down, and literally the same day she was out of pain and acting several decades younger at our little dinner parties that we have, and has continued to function at a very high level. I think she's had a total of 2 treatments over the past 2 years. So you should, in most cases, feel something immediately, not immediately, excuse me, within a couple of days to a week or 2 after your initial therapy, which is, again, buffy coat therapy. And then when you come back for the pure mesenchymal stem cells, again, you may get a boost within a couple of days to 2 weeks. And how long that lasts is really dependent. Interestingly enough, a lot of our folks go for a year or 2 before they feel they need to come back. And it depends on not only the individual, but whether we're actually treating a disease or not. So it's very, very difficult to give specifics, but it's not a long time before people feel and experience the results.
Janice wrote in, is there an age limit? Now you just talked about the younger end of the spectrum. How about the older end?
Theoretically, there would be no age limit, but just keep in mind the story of the Dutch woman. You know, if we can't get enough marrow out of you to actually have to expand your cells or to give you a good dose back, then we would present you with some other options that we won't get into here, but there are always options. But, you know, if a person's 80 and healthy, it's not realistic to expect that we're going to have as easy a time of expanding their cells as, say, a 40-year-old. But it's remarkable how much variation there is. We've seen 60-year-olds who, if you put their cells in front of a hematologist, will tell you that they're looking at a teenager's bone marrow. And we've seen 50-year-olds who you put their cells in front of a hematologist, and they'll tell you, my God, this person's, you know, got a couple of years to go. So it is very variable. It is absolutely individual, and you know, this brings up something really, really important. We talk a lot about personalized medicine. Everybody's jumping the gun on personalized medicine, using you know, saliva to look at genes that are present without even addressing the epigenetic aspects of things. Everything's personalized medicine. You can get your enzymes checked for whether or not you metabolize drugs in a certain fashion. That's actually one of the better uses for personalized medicine. But these people who are doing all these analyses and then making recommendations as to what to eat and what to take and how to sleep and how to exercise based on personalized medicine, I'm sorry, I just don't buy that. I don't think there's any real longitudinal data. But you want personalized medicine, give us your stem cells, let us take a look at them and let us expand them. That's about as personalized as you can get. And it also jumpstarts, I mean, if you do this, you get a couple 100 million of your stem cells back, and you create a situation that's something like what you were 5 or 10 years old, as opposed to 40, 50, 60, 70 years old, that kind of bypasses a lot of that other stuff, at least temporarily. Not that you shouldn't eat healthy, and not that you shouldn't meditate, and that you shouldn't sleep, and you shouldn't exercise. You should do all those things. But one of the reasons why people aren't living to be 120 doing all those things is because no one's really defined what that is. And personalized medicine is not at the point where it can really define that for you. I'm sorry to disappoint anybody who owns one of those companies. I just think it's a lot of premature is the kindest word I can say right now. But I'll tell you what, this therapy is is gigantic in impact compared to some of those other things. Even though, yes, you should always put the icing and the cherries on top of the cake, but you got to have the cake first. In my opinion, this type of therapy is the cake of anti-aging and regenerative medicine. Other questions?
Just a minute. There's literally dozens of them. Just wanted to cut out all the ones so we don't duplicate what we're doing, and I'm sorry if I move over yours. But Kathy wrote in, what's the procedure to return the Buffy coat? Do you use injection or?
Yes, it's an intravenous injection. So when you go in, the first thing that happens is we gain IV access, and that's so that we can give you the twilight sedation, and then we can give you your cells, your Buffy coat back. So that's kind of the first thing that happens when you go into the hospital, is they slip an IV in. Having had various and sundry procedures of this type about 8 times, I don't want to say it's the worst thing that can happen, because it's, I don't want to scare people away. I mean, having an IV placed is a pretty simple procedure, but it can be a little uncomfortable. But it's actually probably the most discomfort you experience, and it's very brief and very short. And thank God the IV staff down there is phenomenal. But yes, that's the way that almost all these therapies are delivered. Now, if you have a joint issue, we'll go directly into the joint as well as IV therapy. So we kind of double down on that for people. So we are able to cover both the systemic aspects of their problem and the localized aspects of their problem as well. It's a good question. Thank you, Kat.
James wrote in, would it be beneficial to use their son's stem cells, who's 40 years younger? Is that a possibility?
It is a possibility, and it is something that, if necessary, we could certainly do. We've done things of this nature before if they're banked. Be advised that most people don't bank their umbilical cords, they bank their umbilical cord blood, and that is problematic. Umbilical cord blood has to be expanded massively, and there's too many passages you have to experience with that to get enough cells to treat an adult. So umbilical cord blood is really only useful during the childhood and young adult phase for the individual. But if you have the cord saved, the cord tissue, very rich in MSCs, and we can process that and yes, give you those cells. And that would be something that Tony can discuss. Tony De La Maza is up on the screen now. Again, the processing of the cells is the critical phase. Having the right team that knows how to process these cells, that knows how to expand them under the least amount of stress, get the best cells out for you, and give you pure stem cells back. These are the critical phases. Most people, if someone is 40, probably has decent stem cells, but it is possible to use the children's cells as well, if you have a source.
Phyllis wrote in, the stem cells that are harvested and then expanded, does this give an unlimited supply of stem cells to be re-injected over time without another marrow extraction or however else you're going to get them out?
Yes, it does. When I say unlimited, again, the current lifespan of the cell that in storage is about 2 decades, about 20 years. So it's not unlimited as in when you're 90 if you had your marrow harvested when you were 30. Again, we are actually working on ways and factors to add in during the expansion that will de-age the cells or at least hold them where they're at. So I think there will be many more options. If you bank your cells now, I think the longevity of those cells will go up logarithmically in the next couple of years. But I have to tell you, the current time frame is 20 years. So the other thing is, by that time, we may have genetically engineered cells. We may have plenty of sources for, umbilical cord cells. There's a lot of other things that can happen. So I wouldn't not do this treatment because in your mind you're thinking, well, I'm 35 now, or I'm probably going to need these when I'm 85. Gosh, they're only good till when I'm 55. That's not good thinking, because this field is exploding and advancing very, very rapidly. But ostensibly, at least for the next 2 decades, it does provide you with a more or less unlimited. And better to do it sooner than later, because your stem cells do age. They age differently, and they age probably slower, we hope, than the rest of the cells in your body. But once again, back to the 114-year-old Dutch woman, they do age, they do disappear, they do become less functional, they do become less able to repair, they do become less able to respond, even in terms of the ones that give immune cells, to respond to specific immune challenges. And if you believe the immune surveillance theory, then you can understand why, if you make it past heart disease, you're probably going to die of cancer and infection. So these are places where we're really trying to make a gigantic impact. Do we add lifespan? Well, gosh, no one can say that yet. It'll be decades before we can really come out and tell you that, and it'll probably be centuries before any government will allow us to say that, so I'm not going to say those things. But just keep in mind that this is a central mechanism for aging. Better to bank now, and you may as well get treated while you're banking. So, again, 29 is the youngest we've treated.
I've got a question from Dan here. Do telomerase activators improve the stem cells you're extracting?
They have to, which is a fancy way of saying I don't know, but they have to. And the reason I say that is because if you look at all the data, and you have to remember, I've been privy to data that is not publicly available. Some of the telomerase activators, and I suspect the one that you're talking about, was developed by a drug company that originally holds all of the initial information on that. I believe I can tell you a little bit about one of them, the most famous one, the one that's been out the longest, was actually originally investigated as an anti-HIV drug because it suppressed viral loads and improved the immune system in terms of helper suppressor levels. And in order to do that, you have to affect the stem cells that become the white blood cells. You can't do that ex post facto. You have to do that during the developmental stage. In order to see some of the clinical things that have happened, I would say they have to. But has anybody really looked at specific stem cells in the niche extracted from bone marrow? You got to give us about another year and we'll have that data for you. But in my opinion, they have to. That's not a scientific statement, however. No scientist would ever say those words to you. That's the clinician in me coming out. The scientists would say, there's no data on that. Anecdotally, we think so, but I'm just going to tell you they have to. But again, I want to caution you as to which ones you use. There's a lot of nonsense out there in that field. There's not a lot of data. There's a lot of people who are piggybacking on the words telomerase activators that haven't done any research whatsoever. And I've read some extremely confusing and very cleverly written copywriting pieces, by people who, it's a sort of true, unrelated. They talk about telomeres and telomerase, and then in the next paragraph they talk about their product. Sort of in a circumlocutus way, implying that everything they just said is true for their product when it has absolutely not been tested or not true. And I can tell you there have been a few that have been tested that you will not hear about the results because they were not positive. So when you see published data on something and you see at least somebody done something in a cell culture line or a mouse study or a human study, that's valuable. Be careful how you pick your telomerase activators. Just because it says so in a PubMed article that carnosine or vitamin D or silymarin or something like that is a telomerase activator doesn't mean that that happens in your body. Remember, telomerase activation is less important than telomere elongation. The two don't always go hand in hand. You must have telomerase activation to elongate your telomeres, but telomerase activation by real-time trap assays, which is what they use to test these, does not mean that you're going to lengthen your telomeres. That's another sneaky way that people try to sell their products. So I'll get off the telomere soapbox here because this is stem cell life. I will tell you that I also think that stem cell therapies are telomerase activation, but that is not scientifically proven, and you've got to give us a little more time. We are have our fingers in many research pies here, and the data comes when the data comes, and it's processed when it's processed, and it's peer-reviewed when it's peer-reviewed. And the average paper that you read from the time that you read it, it's been about 2 years since somebody actually did that study. So just keep that in mind. Other questions?
Back to stem cells. Richard wrote in, he's curious about the length of time that he'll be spending down in Mexico. He says his schedule is fairly limited, but he wants to know how long the treatment takes from start to finish and he can get back home.
If it's well coordinated, we need 3 days. You know, let's say you roll in on a Sunday night and you're out of there by Tuesday afternoon. So that's a realistic. You know, come Monday, leave Wednesday. Again, don't be in a hurry to leave Guadalajara. It's beautiful, and there's so much to see and do there. Last time I actually budgeted a little bit of time, and I went with some of the patients on the Old City tour, and then we went to the town of Tequila. We toured Jalisco, you know, the Herradura in Jalisco, which was just beautiful. So if you can spare an extra day or two, by all means do so. If not, budget on about 3 days.
I think that I've covered most of the questions. I'm sure I skipped over 1 or 2. Once again, just to reiterate, please give us a call directly. We can address your questions personally. I'm not sure if Dave's got some more he wants to do before he wraps this up, but that's what we've got.
Yeah, I just want to say thank you, everybody, for your attention. This was a record-breaking audience tonight. We also had a record number of people stay for the entire presentation, so thank you. I never know, you know, am I too scientific, am I boring, but, you know, you guys, especially those of you guys and gals who've been with me for the 13th year, we're entering now Dr. Dave's Best, now under the auspices of BioStem Technologies, which, believe me, is a good thing. You've stayed with me a long time, and what I found is many of you are extremely sophisticated and extremely smart, and the types of questions tonight were indicative of that, and I'm so glad to have you as an audience, and I'm so glad that you have this interest and passion in staying young and healthy, because I mean, this is what drives me. This is what gets me out of bed in the morning and keeps me up late at night. So it's wonderful to have friends in this wonderful human endeavor. And we are living in a time, by the way, where we are going to make, and we have made, and we will continue to make gigantic strides and impacts on this. There's a lot of blowback. There's governmental blowback. There's even some religious blowback. There's moral blowback. There's all kinds of political blowback. But you know, you can't stand in the way of progress. And I'm never insensitive to anybody's feelings. I would never try to force anybody to do what I do. But just know that I'm out there doing this, and you know, signing myself up for the next interesting procedure, so that I can tell you whether it's worth it or not, and that I can show you the results, and I can speak to you directly about what this has done for me and my patients and clientele and colleagues. And I'm honored to have you join me tonight. I hope you'll join us in Mexico. I can't even begin to tell you what a life-changing experience that is. For those of you who are going to David Wolf's conference in September, I will see you there. Anybody who's going to be at A4M in Hollywood, Florida in the coming, I think, month or so, you can pick me out of the audience there. I'll be there. I'll also be speaking a little bit about telomeres and stem cells. So until then, I wish every one of you a joyous, healthy, and productive life. And thank you for allowing me to spend my time with you. It's been a great pleasure. And we'll see you soon with another one on something fascinating, interesting, and absolutely essential to keeping you young and healthy. Have a great night.